So I'd like to call to order the Public Health and Community Service meeting November 2nd at 8:33. Can I get a roll call, please?
Hendricks. Ness. Shorten.
Here.
Van Hoff. Wagner.
Here.
Altoff.
Here.
Von Bergen.
Here.
This is.
Could I get a motion to let
So
Member
moved.
Ness in? Ms. Altoff, Mr. Shorten, thank you. Good morning, Lou.
Good morning, everybody.
I'm glad you're there.
Yeah,
really. Don't be coughing.
Okay, we have no public comments, so we will move on to member comments. Or did I skipped minutes? I'm sorry.
I'll make
Could
a
I-
motion to approve the minutes as presented.
Thank you, Ms. Altoff, and second by Ms. Wagner. Now public comment, which we have none, so now member comments.
We'll vote on the minutes?
Yeah, we did that too.
Yeah. All those in favor?
Aye.
Motion passes. Member comments. Ms. Ness?
No, nothing.
None. Okay. Okay, we do have a couple of interviews this morning, and
They're not here yet.
we're running a few minutes ahead of schedule. So how about we move on to the routine consent agenda. Since there is only one, could I get a motion?
So moved.
Mr.
I'll
Shorten?
second it.
Second by Ms. Altoff, and any discussion
I have to
on
abstain.
those? Okay. Good morning, Gloria. Hey, Jim.
Still need I have a Wagner abstain, but we still need a vote.
Do we have any discussion on, Hans isn't here.
Brandon's in the building, he's listening, he can get down here if we have questions.
Okay.
But we'll
I mean, it's basically sweep funds that,
I'm not gonna speak intelligently on it, but if we need.
are being reallocated. So if there aren't any questions, then could I get a roll call?
Ness.
I am.
Lou Ness.
Oh, yeah,
Shorten.
Yes.
Wagner.
Abstain.
Van Hoff.
Yes.
Altoff.
Yes.
Von Bergen.
Yes. Good morning. Good morning, Sue. How about we jump back, so motion carries. We will jump back to interviews. This is for the Housing Authority, and first up we have Sue Miller. Thank you for joining
Good
us.
morning, I apologize if I'm late.
No,
You're actually
On
3
time.
minutes early, yes. Yes, so you are good. We're just running a little ahead of schedule.
That's good. That is good.
So thank you for coming in
Thank you.
and interviewing. If you would like to tell us a little bit about yourself and your interest in the Housing Authority.
Absolutely, thank you, Chair. My name is Sue Miller. I am almost a lifelong resident of McHenry County. My mother relocated here in 1967 to remarry. I was 7, so I'm not going to disclose my age, but obviously you can do the math. I am a graduate of McHenry High School, and then I attended Winona State University in Minnesota and received my degree in education. Taught for a short period of time, realized that my entrepreneurial spirit was stronger than my desire to teach, so found my way into small business, which is where I met Pam many, many years ago. Owned many,
Many years ago.
owned many businesses, and then found my way into real estate in the 80s. Since then, I have been a community advocate, a real estate broker, a managing real estate broker, a real estate educator, trainer, teacher, speaker, and more importantly, an advocate for others in housing. So a few years ago, I served as the county board liaison for Chairman Franks to the Housing Authority, went through the transition of the director as well as the transition of departments and funding and managing to serve thousands of families in the county that need assistance every day in housing. That appointment expired, and of course at that point I was super busy at work and didn't pursue anything else. I have since lessened my workload and saw that there was an opportunity for an appointment on the board, and I would love to continue my service to others.
Wonderful, wonderful. Does anybody have any questions for Ms. Miller?
Sure. So looking forward, what do you see needs to happen in our county to help others get housing?
Well, I think there are three factors in the housing arena that jump up or percolate to the top of my buckets. The first, of course, is affordable housing. There is no such thing as affordable housing in today's marketplace. So we need to continue to find a way to create or stimulate that marketplace, whether that's working with statewide incentives, and as a past leader of Illinois Realtors, that was very much on my forefront of conversation. How do we encourage people to build affordable housing? So that's the first bucket that is obviously very important to me in the housing arena. The second bucket is sustainability and keeping people in the homes they already have. The last 3 years in real estate has been really the craziest market I have ever functioned in, and people are underwater and they don't even know it. So at some point they're going to wake up and go, I'm unwilling or unable to pay for what I bought, and it's going to create another crisis. And we have to prepare them and be able to assist them in making good direction. And I believe that's a responsibility of every community advocate. You are an information gatherer and disseminator. So when someone calls you and says, oh my God, I'm underwater, what are my choices? You need to be pretty certain what those choices are and how to administer that. And then lastly, the third bucket that is important to me in the housing arena is the unserved and the underserved, people who can't afford, don't have housing. What do we do? How do we provide? And how do we make that not a stigmatized population? So for me, it's creating new, affordable, because not everybody, we don't live in the most affluent county in the world. 2, keeping the people that are there stable, and 3, providing for those who can't provide for themselves. Does that speak to your answer?
Exactly.
Perfect.
Change the foreclosure rate in the state of McHenry County.
Really? Yeah, the foreclosure rate is going up, and if I can speak to that, the problem that we have that's the unsaid problem right now is that we have about 50% of your current indebtedness sitting at 5% or less in the mortgage rate. And those people are sitting on a lot of equity. So they're refinancing, and the current market rate is 8 to 8.5, depending on your market. So now you have that inequity of, gosh, I have a lot of equity in my house. I'd like to use that as my ATM, because we never learned from the 90s or 2000. I want to use that money, but to do it, I have to take a greater rate, and that greater rate is out of balance with my income. Our incomes haven't grown at the same rate as the cost of borrowing. So as people have the necessity to borrow, they're getting stuck in that big funnel, and that's the funnel that ultimately is going to be the breaking point. And we all know it. We've all seen it. We've all, for some of us, we've lived through it. I don't want to live through it again. It wasn't fun. But it's the reality that people's biggest financial investment is their home. And when they can use it as the ATM machine, they do. And now the cost of that is great.
And I don't even call it a funnel, I call it a spring. It just is getting wound tighter and tighter, and eventually it's gonna sprung, and it's gonna be an issue.
Well, if we've learned anything from the last, and I'll use the word crash, although I hate that word, we tried to nurse it along by implementing a lot of national incentives and a lot of opportunities. And this is probably controversial, not mainstream. If we would have ripped the Band-Aid off and just let the market prevail, it probably would have been a 1-year event, not a 5-year event. But because we kept people along, at the end of the day, we knew what was going to happen. We couldn't fix the problem. So I hope that we learned from the last event what not to do, and we resolve that before it happens again. But your analogy of a spring is perfect, because we're sprung. We're sprung pretty tight right now. And it's not going to take a whole lot to unloose that spring.
I appreciate you saying that, because I think that's the reality. Is a lot of times, on an ongoing basis, it seems like it never stops. Create these artificial markets, and then at some point it's got to catch up. And rather than learning from that mistake, I hold the same hope that you do, but I also, I think we sit in reality, and at some point it's going to crash, and we're not going to learn, and we'll screw it up similarly or in some other way. Hopefully not more spectacular than before.
Well, and to your point, all wars have been fought over land, religion, or money. All lessons need to be learned or redone. So in my world, which has been the last 38 years of my life, you have to look at, did we learn the lesson that we needed to learn? And are we not going to redo it? And I can't sit here and say that we learned the lesson.
Yeah. We
We came out of the mid-2000s, and we've had suppressed interest rates and an appreciating market for 15 years. And you can't, that's not a real market. That's not reality. And I get it, why we did it. It's all about the greater good and the greater economy. But the reality is the artificial suppression of a marketplace creates a bigger picture problem. And you have to pay the price. And unfortunately, this generation's not going to pay that price, but the generation behind us is absolutely going to pay a larger price, because they won't be able to buy a home, and they won't be able to finance a home based on the mistakes that we've made and the lessons we haven't learned.
I've got an ambitious 22-year-old daughter who's right now living at home, full-ride scholarship, so no college debt, and she's a nurse, and she's already like, how can I get out of here? How can I get out of here? And her reality right now is, I'm not going to be able to get out of here anytime soon. So, you take that and you add $100,000 or $200,000 in college debt, and yeah, you've got a real problem. And then you take the marketplace situations that are going on right now, it's concerning. And then when you go back to affordable housing, what's the reason we don't have affordable housing? Part of it is because of an artificial marketplace, large part.
It's a vicious cycle. I have no children of my own, and I have 34 nieces and nephews. So I walk those same paths that you walk, and having those conversations about debt reduction and saving every penny you can and living underneath your means, scrimping pennies turn into nickels, nickels turn into dollars. It's just a different relationship with money, which we have that conversation at every holiday and every meeting and every dinner, but the youth today expect to live in exactly what they're coming out of. And they don't know that there's baby steps and that you have to buy something small. And Pam's looking behind.
No, I'm looking at Scott, because we just had this conversation about affordable housing.
Yeah.
My first place that I lived in was not pretty. On any level, it was not pretty.
It was not, I still own the first house that I ever bought. And it's, 650 square feet, bedrooms are 8 by 8. It has one little bitty bathroom. I had to re-plumb in washer and dryer because it didn't have one. And I'm like, ooh, I probably couldn't live in that again, but it's a great rental, and yet I was so happy because I owned it. And I laughed because that was in 1981 and my interest rate was 18.5%.
Right.
And it was like 18.5%, and when you talk to people today about 8, I'm like, my first mortgage was 18.5%. I refinanced every year to get to 12. When I got to 9, oh, I hit the jackpot. And they're like, 18.5. I'm like, yeah, it was crazy.
I have a question.
Go ahead.
I have a question.
Go ahead, Ms. Ness.
Sue, during your time as liaison to the Housing Authority, what one or two things did you learn new about housing people through either Section 8 or any of those programs?
Yeah, so I learned several things when I worked with the Housing Authority. Having been in the real estate side, I was familiar with the programs. I was familiar with the Section 8, the housing, HUD's dollars and how they flew. What I learned about the people is that there's a misunderstanding of who is a recipient of subsidies. The world thinks that these humans are not valuable. And what I learned in that first experience at housing is these humans have fallen on hard times for some reason, and the subsidy isn't a hand out, it's a hand up to get them through the transition of where they were and to where they're going. That doesn't certainly represent everyone that was a recipient, but I felt more than not the stigma was incorrect. The second thing I learned at housing on my first trip there through the liaison program is the 47 million things that the Housing Authority does, not just housing subsidies, such as the LIHEAP program, the helping with amenities and improvements, doing assistance in rehabs and energy efficiency, working with the different help groups to organize and centralize care. So I think the Housing Authority has always been looked at as just the administrator of subsidies, but they do so many other things inside that small entity that most people in our community and our county have no idea. So they have an image issue. And I think Kim has come in, the current director, and has started working on that image issue. And I think the world is getting a different look at what the Housing Authority does. I personally think they need a new name. Whenever you want to rebrand yourself, one of the easiest things to do is to get a new name and then start over. Because when you call it the McHenry County Housing Authority, everybody goes, oh, it's all about housing. Well, they do so many other things there that I think, and of course that's never going to win any, votes saying rebrand yourself. But I think they need to talk about all the other things they do as well. Thanks, Lou.
Super. I'm happy that you said you view this as an opportunity.
Yeah.
We love that. We love hearing that because there are opportunities there to do some good. And I know you come from that background of real estate, you have a lot of knowledge. But I like also what you said about rebranding. I took a last place team, softball team once, and the first thing we did was change our name. And it made so much of a difference for them. We ended up in first place after 2 years. So I think you can do the same thing with the Housing Authority. And you listed 3 things that you saw as an issue. Do you see the Housing Authority, I know you haven't been there for a while, but do you see them moving any closer towards those three things? The first thing is making more affordable housing available in the county. And
I do. I think one of the components that the Housing Authority has is, first of all, they have a legacy of amazing people that work there. And they have a wealth of knowledge about your community members, and who uses their services. They can list reasons and whys far beyond our knowledge. So you have a talent pool there that should be tapped into anytime a conversation is being made about housing, period. Because they're your local authority that, although we have stigmatized them and said they only deal with the lower or needy, that's not correct. They deal with the wealthiest, which is called the landlords. So they have the whole spectrum of people involved in housing. They have a wealth of knowledge that we should tap into. They also should expand into education and implementation. With that knowledge, and I know there's a lot on their plate, but we have no one place in the county right now, if somebody says what's going on with housing in McHenry County, to send them to. We already have it. We just don't utilize it. So is that an expansion for them? I don't know. I think they already do that when asked, but that's not what they're known for. So I really think, because I was in that building, well, the old building, and worked with the individuals, they're underutilized. They're overworked because they do all that they do, but they're also underutilized in what they could be. And I think that's a direction that they also want to go. They want to become the expert. We had Kim come down. We did a Women's Day a year ago through the Realtors. And we had several speakers that day talking about diversity, equity, inclusion. And we asked Kim to come in and talk about housing in McHenry County. It was her first speaking gig ever. She was a nervous wreck. We had her on a small podium at the Holiday Inn. She spoke for probably a half hour and then had a half an hour of questions. She was beaming, just spewing out the information that she had. And our participants were like, we had no idea. We had no idea we had such a resource. It's because nobody knows. Yeah. So I think that's the greatest opportunity that housing has. My wheelhouse is real estate. My wheelhouse, my second wheelhouse, if I have one, because I was well taught from mentors. Part of your role as a community leader is connecting the dots. You might know someone that they have no knowledge of. And if you put those two dots together, step out and let them do their thing. But as a resource, we all have a network that doesn't always collide. And my job has always been putting people together that need to be together.
thank you.
Yeah, you're welcome.
Well, thank you so much.
You're welcome.
Sue, for coming in. Unless anybody has any questions.
Perfect. Thank you for the opportunity.
Yes.
I would love to serve, if not there, somewhere. Because again, I think I still have a lot to give to the community and more importantly to the county. So thank you for the opportunity. Happy November. It's going to be 60 degrees this weekend.
Yes. Yes. Looking forward to that. Yeah.
So this is the month of craziness, right? Yeah. Thank you.
Yes.
Thank you
So
for
we will
coming.
be,
You're welcome.
we have
Have a
one
great
more
day.
interview and then we will be deliberating shortly.
Thank you.
And we will be in touch. Thanks again.
And thanks for the pumpkins. Thank you. Have a good day. Many, many years.
That was like the very beginning of the conversation and you're still.
Oh, yeah, I'm still, I'm
There's a lot
I'm
after
not,
that.
I'm not on that phone. Yeah.
Which phone?
Many, many years. What the heck?
Oh, go.
What is that?
I feel the
Okay.
same.
Our
Many would have
next
been, yeah.
interview, thank you for coming in. Rosa Luna?
Yes.
we appreciate you coming in. It's a lot easier to do an in-person interview than remote, so we certainly appreciate you being able to come in. So if you could tell us a little bit about yourself and your interest in the Housing Authority.
So my name is Rosa Luna. I've lived in Harvard since 1974. We moved from Texas. My father worked in Harvard, so he decided it was time for us to be with him. So I am, the seventh sibling and 13 kids. So yeah, he decided we were gonna move up here from Texas, so we did. We were like the second family in Harvard, in the Harvard area anyway. And it was tough. It was tough for us to be, because we were Mexican descent, but we, of course, knew the language because we were going to school in Texas, not in Mexico. But it was tough for a while. We really didn't like Harvard, but here we are almost 50 years. And my children were born in Illinois, and they also graduated from Harvard. I was a freshman when we moved up here, and I didn't like the school, so I went 3 years, graduated as a junior, went to MCC in the summer, after my junior year, and I graduated and got out of Harvard because I wasn't happy there. So anyway, right now I am divorced. I have 5 grandbabies, 2 in North Carolina and 3 in Michigan, so that's where I was in Michigan with the grandbabies. I am a country financial insurance agent. I was a customer service manager for almost 25 years for a chemical company. They now reside in Crystal Lake, but they were here in Woodstock. So I'm involved in my community, of course, in Harvard. I'm in the Parks Recreation Committee and also in the Economic Development. What else can I tell you? In my office, I just opened my office here in Woodstock. We had the ribbon cutting, was October, I forget now, 11, 12. Here, right here, where the Snap Fitness is. I bought an office suite there, and last year and this year I had my ribbon cutting. So I try to be very active in the community in Harvard, of course, and here too, because I love Woodstock. I love the square, and that's what we're trying to do more development in Harvard, which it is. It's starting to go with the Motorola company now. It started operating. I think it's just the trial with the gloves, the biodegradable gloves. But there's a lot of development now, building homes in the new subdivisions and apartments, duplexes and apartments. So why do I want to be in the housing? So I didn't realize what this program does. I thought it was just housing that you assist in the low-income families. You help them with rent. But I see all the resources that you have, and when you send me the email, I of course looked into it. I'm like, oh my gosh, this would be great. I don't know what the percentage is here in Woodstock, but I know that Harvard has it's like 52% now Hispanic communities. The schools are higher, the students, but there's a lot of families out there that need help and they don't know the resources, and I know there's still a language barrier within the communities. And I would like to assist in that, and also I don't know how the homeless, how it works with that. That would also, I am interested in that, and again I just feel that I would be an asset to this program.
Great. Does anybody have?
I'll ask the same thing. So if you were appointed, what do you think you would be able to change or do in our community with the Housing Authority? What are your goals?
I think the most important goal for me is the Hispanic, geared more to the Hispanic communities. I don't know, do you have somebody that's bilingual in this board? No? Not really. I know there's a lot of people that can help, but
Do you mean on the Housing Authority, or do you mean on the McHenry County Board?
On both, I would say both.
I think we have, may not be on the board, but I do believe we have staff that's affiliated with the Housing Authority that's bilingual.
It's bilingual. So yeah, I think reaching out to them and to assist more and just make them knowledgeable of what's, what it is. It's not just helping with rental income, but with that. And then the homeless, it breaks my heart to see them, see all the homeless people. We don't have a lot in Harvard, but I know Woodstock does because I see them all the time. So this would be one of my major goals, and just to attract more people to maybe help out more. I don't know what events you guys do, or if you do anything, I'm not sure. And just reach out and try and bring more people to be involved, to engage more in community programs and what we offer, what the community offers. Because you're county, so there's a lot to cover.
Thank you.
Ms. Alta?
My question would be, is we have a couple of applicants for only one position. If you were unsuccessful in being appointed, would you still show an interest in volunteering or being part of this with the idea that ultimately when there was another vacancy, you could move in? I mean, I can hear your passion and commitment and desire, but I also would like you to have a better idea of exactly what we are doing, and come in with an understanding of what's been done, what we have done, and then you can add in, kind of your passion and direction on that. Would you consider something like that?
I would, because again, I know, but I didn't realize everything we do. So learning more about Peru would be best, and you just have to reach out to me because days are crazy.
Yeah.
And everybody's lives are crazy. We're always running everywhere and doing this and doing that. So yes, I would be.
And I concur. I think it's one of those areas, particularly in that Harvard, Woodstock, Hispanic speaking, that we don't necessarily have a direct correlation or contact. So, I really appreciate your willingness to address that.
Do you have any questions? Lou, did you have any questions?
No, not at this time.
Okay. Well, thank you for coming in. We certainly appreciate your interest in the Housing Authority, and hope that hello, Mr. Hendricks.
Well,
We have next up deliberations.
It's a pleasure
So-
to meet you, really. I mean, seriously, thank you so much for coming in. Really appreciate that.
Thank you, Pam.
Well, thank you.
Thank you very
Thank you for
much.
your time.
We will certainly be in touch and hope that you're open to looking at other things within the county also. We have a lot of open things, and definitely learning more about the Housing Authority. There is a lot there.
She means a lot of opportunities,
Yes,
right?
there are a lot of opportunities. Yes.
Thank you very much.
Thank you.
Thank you.
Rosa.
Okay, so next we will move on to deliberation. We have one open seat for the Housing Authority that will begin upon appointment and expire June 30th of 28. Could I get do I need a motion to?
It doesn't matter. We can take
Can
it.
we discuss and then?
It's your
Have
preference.
a
It's your
motion
It's
to-
your preference, Jenny.
Okay, how about we have a discussion on the two applicants that we just interviewed, and then we'll just look for someone to suggest someone to fill that.
Oh, I'm
So
very
who wants to-
I'm
yeah, we'll go.
wants to
very
lead
impressed
off
with
the-
Sue Miller. She has the background in real estate, plus she has background on the Housing Authority. And I really like that she sees the big picture and knows that, this group has so much more potential And there's so many other areas that they can communicate to the public, and I really think that she would be a great addition.
I concur.
I-
And I think that Sue is, and she said, I've known her many I'm
See, she didn't say
sure,
that about me, so.
I'm sure, I know, she looked right at me when she said it too. But I'm also confident, not only in her expertise and what she would bring overall to the Housing Authority, I am utterly confident that she'd be the one who would reach out to Rosa, who I think is another phenomenal
Yes.
applicant,
Yes.
and draw her in and then teach her so that we have maybe somebody who slides into whatever vacancy comes forward. And I think we do need more representation from a volunteer level from the, I'd say Latin, but Hispanic communities. I really do. So I don't want to lose her either.
Right. Do we know when the next?
June of 25.
Okay.
I have a comment. I think the idea that we could get a bilingual, bicultural person on the Housing Authority is really wonderful, and because there isn't that there right now. And I also and I don't know this, and I'm the liaison to the Housing Authority. I don't know what the percentage of people are that use, like that are Latina people that use the Housing Authority services. And having said that, though, the thing that even beyond Sue's experience, I actually think that she will be able to jump in and have a strong voice at the board table. And she would not be silent and quiet. She wouldn't take a lot of onboarding. And I think that's something that could be very beneficial to the Housing Authority Board. So I would concur with what others have said, and I would support Sue. But I love the idea that, you know, Rosa's on the Harvard City Council. She's stepping up to serve. She's growing her, you know, her visibility in the community and getting involved and finding ways to keep her engaged, I think is important.
I agree. I think she's a wonderful applicant.
Yeah, I agree.
Unless you have something else to add, I mean, I think I'm in concurrence with the direction we need to go. And I'm, you know, willing to put forward a motion to recommend Chairman Bueller, Sue Miller, for the Chairman of the Housing Authority.
Okay, so thank you, Mr. Shorten and Ms. Weckner. All those in favor?
Aye.
Aye.
Oh, nothing, I was clear. I didn't, but I do appreciate the expertise that Sue has. I think that's important, and the knowledge and the empathy. I think that's really important in this position. And I do hope that, I think she would reach out to Rosa. I think that's very important because we need representation.
So can I make that request of you? Can you, when we do that, can you reach out to Sue and indicate that the other applicant was equally worthy, and maybe there would be an attempt to get Rosa somewhat involved at whatever level the board thinks appropriate, but I would hate to lose her enthusiasm.
Yes.
And again, the Harvard connection, I think, is extraordinarily important.
Yes,
Yeah.
I agree.
Yeah.
I think I would also like to know if there is anyone on that Housing Authority Board or involved as a volunteer who is bilingual.
Well, I know staff is. And you're right. But I do know.
I mean, I think that brings out an important point, because most of the agencies that you go to now do have literature written in both in English and Spanish.
They do have bilingual information.
Okay.
Yeah.
But as far as any volunteers or staff?
I don't know how they use volunteers at the Housing Authority. We really don't talk about that.
Okay.
But I do think that it would be, and I think Kim would be open. Those are open meetings. Rosa could certainly go to those meetings. and attend and become more knowledgeable. And I do think there's someone's term is turning over, but I can't at this point tell you who that is.
Not till
So
25.
Not, yeah, 2025.
But that doesn't mean,
Yeah,
you know,
that-
all 5 other things
that-
can
that-
happen in between.
Right.
We don't
Right,
know.
and 25's not that far away, folks.
Yeah.
Many years.
It's not many years.
Okay, yes, I will certainly reach out to Sue and suggest that she have a dialogue with
And to
Rosa
Kim, and to Kim.
And to Kim, yeah,
Mhm.
which I'm sure she does. Anyways, I think that's a great idea. So, okay. So we made it past routine consent, so next up is old business and the resolution authorizing $313,000 in ARPA funds to execute a contract for a software platform. Could I get a motion to, okay, Mr. Shorten, second by Ms. Wagner. Do you want to start off with specific questions, since you were the one to ask
Yeah.
or to come back to the committee?
And just to repeat what I said at the board meeting, you know, I'm following the sword on this. We had our last public health meeting right before the budget and kind of slipped by. And I was reviewing for the voting meeting. I just had a number of questions that popped up into my head. Because as I look through the, you know, everything that's associated with this, the 313,000, almost 314,000 over 5 years for data dashboards, it seemed like we're spending a lot of money to update our website to include visualizations. It's mostly for the general public. Now I understand during the pandemic we were having, and thank you Melissa for sharing, 17,000 visits a month between 2021 and the first half of 2022. Currently we have, I think, less than 2,500 visits a month going to the website. I jumped onto the Department of Health website, which I haven't been since COVID went away, and probably the visualizations that people were looking at the height of COVID were hospitalization rate, death rate, and I think there were like, correct me if I'm wrong, but like 6.
Fire!
That's, she's yelling at the dog.
Oh, sorry.
No problem.
What did I say?
Sounded like Mike.
There was an M at the beginning, so. But so I took a look at the RFP and the addendums that went out to the bidders, and it seemed pretty clear that these visualizations were generally going to be there for the public at large. So then I look at 313,000 over 5 years, and what's the value here? So what are we trying to achieve, and why does it cost so much?
So, okay, we'll start with what are we trying to achieve? So data sharing is a big deal in public health. We learned that this was a big gap during the pandemic. People they were voracious for data and information. When those dashboards, like if there was a delay in getting them updated, people would reach out immediately. They were honest, like, what's going on? We need that information. Media, it's not just the general public, our residents who live here. It's the media. It's our community partners. They use this information. And this goes well beyond COVID, but that is what we kind of started with those visualizations with COVID. So it's about increasing access to the information showing actionable data. It's about decision-making. And it's just a critical component and best practice of public health. It allows us, the health department, the county, and its stakeholders to be better informed and prepared. And it supports our program evaluation, our outreach. So it's bigger. I think it also, we specifically have in our strategic plan a goal around data sharing. And I think it also supports the McHenry County Board's strategic plan about information sharing, collaboration, looking at how we can improve programming. There's a lot of data that goes into this. And it's also, a national movement to modernize public health data. On a state level, we're required to do our community health needs assessment and improvement plan. That information, we get contacted all the time by community partners. They use that information. This will make it easier for people to see and utilize the data. Our hospital partners, we collaborate with them. We collaborate with the Mental Health Board on data sharing. It will include not just COVID, right? We are talking about infectious disease. We're talking about our MAP priorities. So that kind of gives you a background on the why, the cost. Okay, so you asked why this one over the other one? This one has more capabilities. Our staff are very well-trained, our epidemiologists, they understand the data and how data needs to be communicated to the public to make it easy and digestible. There's more flexibility and control over the data through the Metopio platform versus the other vendor that responded. It also has comparative national data sets available. And I know you had a question about this. Other regional partners use this. So as we're looking at comparing and contrasting data, right, it becomes apples to apples, right? They're comparing against the same data sets. And regionally, as part of a consortium, we're advocating for the state to utilize this platform. Now, we don't know if that's going to happen, right? But the more people who are using it, because data modernization is part of the direction the state is moving. It's also going to help save staff time. We have been we are very grateful. GIS has done so much work for us internally, but this is going to take work off of their plate, and those activities are going to shift over to this platform. And some of the other so there are platforms that are more expensive, and then there are platforms that are less expensive, but this is the one that met the needs and the capabilities that we need in order to communicate that information out. It's also going to include other data that other county departments can use, right? So it'll have transportation data. And we talk all the time about sharing information and sharing data. So it does have the ability to potentially benefit other departments within the county.
You got your hand up first.
I would just point out too, it's $313,000 over 5 years, which basically breaks down to about $60,000. I mean, 5 years is pretty typical for a contract like that with that kind of investment in data so that you have that availability. And I don't think that $60,000, a little bit plus, is a whole lot of inappropriate fund expenditure on a yearly basis.
And it's not whether it's appropriate, inappropriate, it's just, again, the value, what are we getting out of it?
And see, again, you're absolutely correct. I think that there's a significantly huge value to all of this. I mean, what was the one thing we got criticized about COVID all the time, right, is information.
Right.
And being transparent, and we had started a project before COVID, a community data sharing project, and there was so much interest, but COVID sidelined that, right? Looking at better ways that we can share information, we can show progress, we can set metrics so people can actually see, like with our community health improvement plan. If we say we're going to improve something by X amount, I believe these dashboards have the capability to show where are we, right, in relation to the goals that we are setting.
And I had a question, I guess, when Mike made the motion to send this back to committee. I seconded, not because I didn't think that was needed, but because I felt I wanted to have more information as well. So thank you, Melissa, for coming and explaining some of the specifics of what you're going to do with that. And when it came up for a vote, I didn't realize also that it was over a 5-year period. So one thing I would like to ask about, when COVID first started and the health department was starting to put data up, I was working in Lake County. Lake County was posting daily positivity rates, and they were doing that. McHenry County was not. McHenry County was posting weekly, but at some point during COVID, you did switch over to reporting it daily. And I really liked it when you did that because you can know at any given time what kind of shape you were in the county. So like if you're on a diet and you weigh yourself every day, you know, have lasagna like I did, you know, the other night, and get on the scale the next day and you see that maybe you were 2 pounds heavier. You don't want to wait a week later, maybe you had lasagna 5 days in a row or 7 to get on that scale. So that daily positivity rate was something that I look for every day in Lake County. It wasn't here. I was glad when you put it up. And will this system make it easier for you to share that information because you
Right,
do
it'll
have
be
it?
more
It was a
quickly, and
7-day
we had,
rolling
yeah,
average.
and we had to build our capacity and capability to get to that point.
Okay.
We have a larger team now than we had at that time.
Mhm.
The amount of data that was coming in was extraordinary. So again, GIS worked with us, and I don't know if Susan wants to add anything because the EPIs are under Susan, but this is precisely something that at the start of COVID, right, we had to build up to do, and these kinds of technology software platforms will allow us to share information much more rapidly than we were capable of doing at the start of the pandemic. Do you have anything to add? No.
Thank you. Thank you for explaining some of those
So,
specifics.
I support this. You mentioned transportation and statistics. I know transportation is an issue that we need to address, especially with the lower income. So how do you mean that this would be able to track transportation?
Well, do you want to speak to some of the data?
The data sets that are available or data sets that are available through this platform, you know, it's national data, so there's going to be multiple data sets that do affect public health. We know transportation affects public health, education affects public health. Those data sets can be pulled into this platform for our epidemiologists to possibly work with those entities and partners in our county to what are you wanting to see, what are you wanting to look at, can we work together to form a dashboard that you want to share with the county or with the general public or your partners. But you know, that's definitely a long-term project, but the capability is there.
So I'm just for clarification, you mean like the lack of transportation or the transportation needs? Is that what you would be able to do?
Well, I think it's really what is the Department of Transportation wanting to show? Is it, you know, those spots that are lacking in transportation needs? I think they do have that data. I don't know how they get it, but this would be a way to maybe pull it together in a more efficient manner and display it.
And let me say too, also, people working in, say, Lake or Kane or, you know, a surrounding county, but coming back to McHenry County where they live. So that data is also available, you know, on a system like that.
So we have the data. It's just taking the data and feeding it to.
So we have
Metopio.
local data, right? This also pulls in comparative data, right? So how do we compare to other states or other communities? Can you speak to the comparative data, other local comparative data, county data?
I mean, the opioid surveillance is a good example. What is the national level? What's the state level? What's happening here in McHenry County? Our epidemiologists are able to pull in all that data and analyze it and compare it to McHenry County. How are we rating? So when we do our community health study that we just completed, that work that those epidemiologists did is going to be much more efficient to pull in data because they had to go out and find this data. They had to go to multiple locations and pull that in and pull it into its raw form and do all this analysis in the background. This platform will do that for them. It's going to be there that they can pull it in, analyze it, create, and do these comparisons of what we're looking for. Because, I mean, what are we measuring? They have to, pull that in and analyze it for us.
How many epidemiologists do we have?
We currently have 4 on staff, 1 being the coordinator. Going into COVID, we had 1 for a population of 310 people.
What's the average?
Oh, EPIs per health department?
Per population.
I doubt there is that statistic, right? I mean, somebody could probably calculate it, but every department, so, there's a saying, you've seen one health department, you've seen one health department. There are so many health departments that can benefit from having an EPI, but they don't have the means to support it. So by having a larger data team, the amount of surveillance we can do, the amount of tracking the data to look at other community-wide priorities it's worth every penny we spend, right, to support these positions. And again, it's also about collaboration and working with other community partners so that people have access to the information they need to make informed decisions. Again, community partners reach out to us all the time to ask for the data. And this will help us provide that.
Eric, did you have a question?
Oh, Susan has a
So,
comment.
just to piggyback on Melissa's comment about community partners, we do get calls a lot from community partners that are applying for grants that are looking for data because they're trying to search and find this data and do comparisons to apply for grants. This will make this easier for them. And if we don't have the dashboard specifically set up for what they're looking for, our epidemiology team can find that for them and help them to get that data available. And just, the comment about 2,500 people visiting our website is not used to its full capability, and we are working on that as well. And we think that if once we get these types of platforms up there, dashboards up there, that the number of people visiting is going to increase because of that availability of data that would be easily found on our website. Right now, we're getting phone calls.
I have a couple questions.
Sure.
So, as far as you said the state, you're trying to lobby the state to adopt this software program, but obviously no guarantee. Say the state adopted a different provider, how does that affect the usefulness of this project?
Are you able to speak to that? I mean,
We probably would we would go to that other platform.
And do we have a time frame for when the state would be making that decision or not?
well, so, no, I don't think we have a timeline,
Or
but
if
I
there's
would
like a
say
goal by the state, are we aware of that?
the state is talking about, right? I mean, it is a
Yeah.
national conversation about data monetization. All of the regional organizations that are representing the local health departments. So we have a Northern Illinois, there's a central one, and a Southern Illinois, right? Those conversations are all happening because everyone is sort of in the same boat that needs this type of support. And this is one way that the state, just as an example, right? Transformational systems change, right? How can we all be using similar or the same software, right? That's going to reduce the cost over time. Now, whether or not it's going to happen is a big question. But obviously, if we would have the choice to make if the state uses another platform and they're paying for that, then we would be looking at that as, does that make sense? Does it have all the capabilities we need? And is it saving us money?
No, and I appreciate that. I guess one of my concerns is if they adopt it 2024, but we have a 5-year contract here.
The state moves pretty slowly,
Yeah.
so I am not expecting a rapid turnaround, right? Like maybe in the next 5 years, like the timeline we're on, right now we're proposing this is covered by ARPA. And I don't mean that as a diss against the state. It just does move slowly, right? There's been changes in leadership, so this takes time to sort out how they're gonna make those changes.
And so obviously the state doesn't use this program now. Does that affect the ability for us to utilize it in obtaining state data now?
No, because we get that information and then the EPIs pull it in to this platform.
So even if the state did adopt something, we would be able to use this
Yeah.
in the interim?
Maybe speak to an example of Salesforce, like what happened during the pandemic and.
Well, during the pandemic, the state brought on a platform called Salesforce for the contact tracing data that fed into our what we call INEDS, which is the national database for just case investigations. And that platform is not being used, but now they're looking at integrating that platform into the INEDS platform, so that Salesforce will be, all our work that we're doing at the local level will feed into that system that goes up to the CDC, but it will be in Salesforce because the capabilities are much bigger than what they currently have. So right now, that is their focus with the data modernization. So as far as the forward-facing, because that's internal, so the forward-facing data platforms are going to come much later. And there is legislation about data sharing with the state with us, because there was a concern that we weren't getting the data even out of that system that we are putting in internally. And that process is happening now, and that's coming forward. So to your question, as far as the external dashboards, it is, I think, much further down the road. I think we're comfortable with this 5-year time frame, and that we would have a better idea at the end of that contract where the state is at with this process.
Okay, and I think the last question I have is the cost of $314,000. I guess it's a two-part question. One, I was looking, the next bidder was approximately half, roughly. So part one of the question is, what's the additional utility that we're getting from this specific program? And then two, it was briefly mentioned that there's potential for other departments to use this program. And if so, does the cost of the $314,000 cover that, or would there be additional costs or an additional contract addendum to bring in, say, the Department of Transportation? Or is this the fixed cost no matter where we're using it across the program?
I don't have the answer to the last part of that.
Okay.
And what that would look like, contractually with the company. We'd have to have that conversation with them to add more users and more platforms or a dashboard capability. I'm sorry, what was the cost of why we chose this one versus
Yeah,
the other?
What are the capabilities?
Yeah.
What distinguishes this?
Exactly.
So primarily I let our epidemiologists provide that feedback, because they're the ones who are going to be using it. And they actually looked at both the proposals, and they felt like they would have more control over the Metopio, because Metopio is giving them the access that they can go in and build the dashboards however they want. The other entity or organization that turned in RFP, they limited that access, where they would have to go to them to have them initially build it before they can get in there and do anything. So they felt that this gives them the flexibility and the nimbleness to make a dashboard pretty quickly without having to work with this entity. They can do it. They're being given access to do all of that and set that up. In addition, they felt like there was the access and use of it was easier as far as pulling in that data to do the analysis in the background versus the other platform.
And I believe
And
there's
that's
also.
huge. Let me just point out that working with systems like that is huge. When you can go in and structure it the way you want it to generate the reports that you need.
And there were some website changes or tweaks, right, that would have needed to happen with the other.
Yeah, correct. I mean, it's just a much more flexible system. Now there, of course, you see the higher, the $75,000 the first year. That's to help us come in, teach us how to use it, teach us how to set this up, help us to set it up, our initial dashboards, until our team feels comfortable that they can do it on their own. They are there for support. But we don't have to rely on them if we want to go in and quickly set up a dashboard and push it out public facing.
And I would just think that's easier if the state chooses a different program too, if you have the nimbleness to kind of, accommodate somebody else's request.
And honestly, we didn't have, just as far as references, we didn't have anybody that we really, they included those, but we did have local, entities and counties that are using Metopio already, that we were able to reach out to them. Our APPs reached out to their APPs and said, what is your experience? And it's been very positive. And the one thing that they really liked is Metopio they have meetings with them on a quarterly basis to say, what is happening? What more do you need? And they're actually implementing things that the local health departments have brought forward to say, hey, we'd like this capability, and they make it happen. So they like that, customer service coming back saying, what else do you need? And they're working with them.
I'm just curious, what other counties are using?
Lake County and Cook County.
I figured Lake County was, because they were doing a good job. They really did a good job.
Mr.
So
Shorten?
it's like Lake and Cook have Metopio platform on
They
the
use Tableau and are moving to Metopio as well.
Okay. Are there any counties that have Metopio on their website currently?
My understanding is both Lake and Cook are using Metopio.
Lou, did you have any questions?
I did not.
Okay, thank you. So seeing no other questions, thank you for coming in and answering questions. And so I think we could move to a roll call.
Wagner. Yes. Van Hoff.
Yes?
Hendricks.
Yes.
Ness.
Yes.
Shorten.
Yes.
Altoff.
Yes.
Conrad.
Yes. Thank you again, everybody. So seeing no presentations, we'll move on to the discussion of the Mental Health Board's sales tax referendum. I think Pete was gonna
Yeah, and I
start
don't
us
have
off.
a great deal to talk about, because this is kind of just an idea at this point, but I was laying in bed this morning at about 3, and I thought maybe this visual that Dan's gonna bring up could help. But, just by way of background, in our discussions in October, it was more than once referenced, what if there was a mental health sales tax? And the example of Winnebago County was offered. I had some more conversations with Chairman Bueller a week ago, and he said, let's start the discussion. There seems to be a real appetite to give this some consideration. So I said, well, I could put it on PHS and we can start talking about it. But it is important to talk about it sooner rather than later. And this is why. If the desire is to move ahead and place this referendum on the March primary ballot, the direction from the county clerk is that the drop dead date is January 2nd to get it on the ballot. Therefore, you back it up, that really means we would need to make a decision in December as to whether or not this is going to move ahead. What I'm telling you is kind of preliminary. The state's attorney is working on the subject. They kind of have this thing about 3/4 drafted in terms of what the referendum question would look like and what are our options. I'm of the mind that you can only do in quarter-cent increments. We're going to challenge that, but I think that's the rule is quarter-cent increments. So a quarter cent that we estimate for the RTA sales tax generates is going to speculatively generate about $14.3 million in 2024 for the Division of Transportation. Ergo, another quarter cent would be about $14 million for the Mental Health Board if it was in place. I'm thinking about this really in terms of developing the 25 budget because if this was to go as soon as March, typically the Department of Revenue needs at least 90 days to get things in motion. So you really wouldn't start, at the earliest, I don't think you'd start seeing anything until about July 1 in terms of new revenue. So I really think it's a tool for fiscal 25 budgeted.
And they don't do it on a monthly. If they don't have it done, it's a quarterly, so even if you may be bumping up against that deadline, you might not even see it until the last quarter. I mean, just.
I did talk with Leonetta Rizzi about this about a week ago. She's sorry she can't be here today. I know we have a couple of members from the mental health board and staff here if they have any comments. But Leonetta, when I talked with her a week ago, she was a little bit concerned about the March timeframe. I don't know if her position's changed there, but just about the speed of getting to that vote and versus the opportunity to educate voters on what it means. For those of you who are visual, it's the orange. You can imagine our property tax levy without that orange chunk. We're proposing just shy of $11 million for next year. That's at 10.5 there. But that would be going away. And that would be powerful. I mean, you'd be making a further reduction in the property tax levy. The county portion of the total levy is getting smaller and smaller as schools are getting more and more, and I was working on this a little bit with Member Greeno yesterday and kind of talking about the history of the county levy and how it has gone down over the years, over the last decade, coupled with inflation, coupled with what other governments are doing. Our slice of that pie is getting smaller, and it would get even smaller were this to be in place. It would be a lot of money for the mental health board, to be sure. But as I kind of also mentioned / warned, when we compare ourselves to Winnebago County is not an RTA county. We are already paying a half-cent more in sales tax than Winnebago County is. We also have a number of home-rule municipalities in McHenry County that have put their own sales tax on top. So there's a number of places where you shop in McHenry County where you're already at 8%. I am expecting, as part of the bailout of the RTA, that there's going to be another $0.25 there. So that it's kind of building. Now, if we went ahead with a March referendum, we probably would be ahead of any RTA decision. But I'm sorry, I'm rambling, and you're going to say something more intelligent than me.
A couple things. There also is conversation and effort at the state level to go back to what they had put into place during that, massive inflation, and to do away with grocery taxes. So that's, so it's not just all adding on. There might be some availability of again, another reduction in that area. Again, if you talk about this, I too am concerned about educating the public as to what it is that they're voting on and how that's going to affect them from a property tax perspective. I know that there was some concern in Winnebago that some of that retail sales tax dollars did dip and they got potentially less. I think we need to talk about that. I don't think that will happen in McHenry County. We're a little bit different, from our retail perspective, but again, I think it needs to be addressed. And then the other portion of this is that, you have all kinds of people who don't pay property taxes who will be paying sales tax, which is a benefit. So, there's a whole lot of moving pieces, but my biggest concern would be educating the public as to exactly what this is doing and how it's affecting them and how much money they can anticipate. And many communities are adding on, and nobody seems to be real upset about adding on to their entertainment tax. I know that the home rule communities were talking about adding on to their sales tax, and there may be pushback, but ultimately, people are still shopping in McHenry County. So it's a choice, right? You can choose, and you can, property taxes, you can't choose not to pay. You have to pay. If you own property, you pay. Sales tax, if you really choose it's too much of a burden, you have options.
Now, is Winnebago the only example we have in Illinois?
I do not know the answer to that.
Okay,
That's
so
the only one that was
I just
cited.
feel like we need more information, and I do feel I share the concern that we need more time to educate the public and to educate ourselves with what this would mean. And I'm a little concerned about sustainability because, if if it does dip, we're looking at 14 million now, but that could change. I still think it's worth talking about, but I think trying to get it on the ballot in March is, I think that's tricky, because if we don't educate the public, it's not gonna pass anyway. You
Yeah,
know what I'm saying?
there's different political scientists would
Argue that,
argue
yes, they would.
which is a better, it's typically a more sophisticated voter.
It may well be, but
it
we
also
don't
depends
educate
on-
the public, it's not gonna
I know,
pass. You know what I mean? Because if they're looking at something and they don't know what it means, it's just not gonna go.
And I would tell you,
I have a,
go ahead, Lou. I'm sorry, Lou, go ahead.
so how much will it cost us to run the referendum?
It's incidental. I mean, there'll be ballots. I'm assuming there'll be some other
Well,
ballot.
who's going to do the public education
We
piece?
can't.
And it's not gonna be the McHenry County government.
Don't
can't be.
forget, there's legislation that we can't do that.
Yeah.
Okay, how will we educate the voters on the referendum?
That's not this body's question.
Right.
So we have no control over that.
That would most likely
Come from
fall
the-
into a
the
partnership with the mental, right,
health.
exactly.
Yes.
It seems like.
And right, I understand that, but I want to be clear about that while we would want this on the ballot in March, in a primary, which probably is not a bad idea, does the mental health board have the capacity to do the community education? That would be my other.
There's a difference between, I mean, education, we can have, I suppose, information pieces on some manner of what this would generate, what this would mean, but you gotta really stay away from advocacy.
Mm-hmm.
Yep.
It would have to be the mental health board
And
taking
it
the
can't,
lead.
no, it really can't be,
It's a taxing body.
they can't advocate either. They can educate.
So,
Yeah, I just
so
thought
who
about
would
that, you're right.
initiate it then? Who would do the education?
I get that, but I remember the progressive tax, and it was confusing to people. They didn't know what they were voting on.
Mm-hmm.
The rollout was not done well.
Mhm.
All people read was tax.
Mm-hmm.
And so my question is, and maybe I'm asking the wrong person, does Leo believe the mental health board has the capacity to educate the voter on this referendum? That is what I'm asking. And maybe I do need to ask her that.
They can't.
Right.
They cannot.
Why
Legally-
can't they?
Legally, they cannot.
Because they're part of the taxing body.
You can.
I'm not talking about advocacy, I'm talking about education. I know the difference. They can't say vote yes, but they can educate what the referendum means and what people will be voting on. Someone's going to do that.
It's a fine line, Lou, and I think they'd have to make that decision at their board level. It's a very fine
Yeah.
line, and you wouldn't want anybody challenging that.
Mm-hmm.
No, and Pam, my question is, do they want to do that?
Right.
Are they prepared to do that?
I don't think that conversation has happened.
Well, we do,
Yeah.
I apologize, we do have some
Yeah,
members here.
I was going to bring them to the table. Mr. Shorten did have a question?
No.
Or no? Okay. So yes, I guess if you guys would like to come up and
Okay.
maybe, yeah, give us some insight as to what your feelings are and are your feelings that of the mental health board as well, or?
I have an easy answer to your question, which is we haven't even been able to discuss this. So to be honest with you, we are in our budget allocations last month, and so this is something that we can bring forth to the next meeting. My suspicion is that we will have more questions than answers and opinions at that point, and would need time to learn those things. As far as the capacity question that Lou asked, I am sure we would be willing to do whatever is the appropriate thing to do, the legal thing to do. Whether or not that could be done in a time frame by March, I think is probably a concern of ours as well. Want to add anything, Melanie? Yeah, I know we already have some questions that, you know, how does this impact our relationship with county support? How does this, you know, impact, you know, our budgeting? What would the transition look like? There's a lot of questions that I suspect you guys would want the answers to, and we would as well.
And when is the next meeting?
November, so we would have our next full board meeting the end of November.
Towards the end of November?
Yeah, I can
last
get you
Tuesday
the exact date if you'd like it.
No, I'm sure I can find it, but thank you.
After a quick Googling, I did see Kankakee County is looking at the same thing.
Yeah,
So,
They're looking
That
at
might be
it,
a
but it's
good-
not implemented there yet.
right, well,
I
they're
would-
looking at, so
I
it
would
might be a
really
good
like to
idea,
see
just a minute. It would be a good idea for you guys to maybe contact them and come up with, you know, see what they're doing.
Yeah, I'd like to see someone who's done it already and what their concerns are.
There's all kinds of examples of counties that have passed a sales tax for a purpose, not necessarily all mental health, but for a purpose, that you can get a template. But if we didn't do January 2nd, when's the next opportunity for us to put this on as a referendum question?
I'm guessing it's early September for November.
That's what I would think too. And I would just.
And that's fine, it doesn't, what that would mean is we would do another budget year.
Understood.
Arguing about how big the orange should be.
Yeah.
I get that, but we're also potentially still there if we have an unsuccessful referendum because people don't know what they're voting on. So, I mean, I grapple with that too, and I've been involved in all kinds of referendum questions here in McHenry County, and the worst thing to do is to throw a question out to people who are really uneducated about what it is, whether it's a school board of election, which is a smaller group of population, as opposed to an entire county. So I do have major reservations about throwing something on there without educating people.
And you think, so if you have it in March and it doesn't pass, we can't put it on November, right? Because it'd be asking the same question. Don't you have to
The
wait?
timing, I
till
think
the
you do have to wait, yeah. I think you're right, Kelly.
So, and then also, I lost my question, hold on. I mean, there's also the discussion, what's better, to have it in a primary versus a general election too?
And I don't really have a sense on that.
Presidential, yeah, it'll be, which everybody comes out. But is it, well, I don't know.
That's a good indicator, though,
I-
of what the people want.
Yeah.
So,
I'm
Regarding
all
the
about
question
that.
of education versus advocacy, the mental health board has their own legal counsel, and I would defer to them. We at the county level, we dealt with this nearly 10 years ago on the referendum whether or not to create a county executive form of government. And I remember really, while I had a strong opinion, and we were really hands off of the topic. People asked questions, we had answers, but we weren't communicating anything. We weren't pushing information. Let me put it that way.
I mean, from an organizational standpoint, you cannot. From an individual perspective, I can have an opinion, I can share that opinion, but whether it's the county itself or the mental health board on this subject, you can't really. We had a garbage referendum in Nunda, it was probably about 10 years ago, which the supervisor on his own put out on a newsletter, an article that was like not quite balanced, and, but use taxpayer funds to do it.
Yeah, that's an example of how you got to be careful.
Yeah, that's what I mean.
Using public dollars to communicate.
Yeah.
But you do have to have that communication somehow. When I was covering the McHenry Library Board and they passed the referendum the first time, they were not really transparent. People didn't know what they were voting on. All they saw was that, they were going to be paying more money. And so it did not pass that first time. And I was covering those board meetings, and I remember going to a board meeting and they had a packet there for me that did not have the plans for the library. And I asked them to share them with me. They refused and said they didn't want it to end up in the newspaper. So I knew who their attorney was, Rich Curran. I gave him a call and said, I really don't want to have to file a Freedom of Information Act. He was like, you don't have to worry about that, I'll talk to them. So they shared the information with me after that. And I told them, if you really want this to pass, you have to be transparent, not just with me, but with the public. And, you know, so after it failed the first time, the second time around, they put the plans in the paper, they answered questions that people had, they explained to people why it was needed.
But it was before the legislation passed, Gloria. All of that happened before the legislation passed that limit utilizing taxpayer dollars to promote a referendum. So it's not, it's completely different.
That transparency though people did vote for it and it did pass the second time.
What you'd have to do and what typically happens if you are really that committed is you have to create an outside committee that would raise funds, that would assist you in your education. So it would be private funds.
That is Leonetta's position as well. She said, I don't have an advocacy group formed yet. She understands that that's what needs to happen.
Exactly.
Yeah, and that would do it, you know. But if people have questions about it, they're not going to support it. So that transparency has to be there.
The last point I wrote down was just that. What does the mental health board want? I have an early sense of what Leonetta wants this referendum. Her early sense was not March. I don't know if that has matured at all, but I think that maybe would be an important next step is for us to hear from the mental health board in terms of what they want.
I agree. I think March is premature. I just think it's premature. And I would really want the mental health board to take the lead on whether they think this is going to be good for them long term, not just as, this feels reactive to me, and I do appreciate the information gathering. I would not support a ballot referendum in March. I just think it's too soon.
Quick question. So the rate would be what percent of?
It's my caveat. I'm waiting to hear final out from the state's attorney, but I'm working with the assumption it would be a quarter cent. That's the smallest increment you can do. You could probably ask for more, but I'm working with the assumption that a quarter cent would be the smallest increment you can do. And I think that will generate just over 14 million.
Okay, so
in the first year, and it would grow thereafter.
So, and I'm not suggesting this, I'm not advocating for it, I'm just asking the question. So if this referendum were to go on the ballot, whether it's in the primary or in November of next year, and it passes, and then the $14 million would then flow into the mental health board, this 10 odd million could either be passed along in a reduction, or we could use part of it to deal with our $2 million hole. If there's a point where, and I don't know if this is going to happen, where the economy really regresses.
Your timing, it doesn't happen overnight. So you pass the referendum, if you did it in January, assuming, right, and you'd have to let the state know, you wouldn't collect that money.
No,
okay.
No,
yeah.
I understand all that. I'm speaking in really broad terms. But, so they have the 14 million coming through, hypothetically. We have this $10 million that we can either reduce taxes or, use part of it where we need to, whether it's, taking those ARPA operating expenses and moving them over. At some point in the future, if the mental health board, the revenue stagnates because of economic spending, what have you, it's not a situation where their sole source of funding is just the sales tax. Could it also be conglomeration?
That's a good question, Mike, and I'm working with the assumption that it becomes essentially their sole source, right? The voters did approve a a levy in the late 60s, that is that.
Yeah.
Does that referendum question contemplate undoing that levy? I think that is part of what we need to ask ourselves. If it doesn't, then I think you have an opportunity for kind of a double barrel funded. But I'm also going to assume that that orange is going to be brought down to nearly nil just to keep it in place, just like we have at Valley High right now. We're putting $10,000 a year every other year at Valley High just to keep it in place. That might be what we would do here. Unless the resolution, the referendum question specifically asked to abandon the mental health levy.
And I think that would be short-sighted.
Yeah, I think so too. That would make me feel a lot better if we did keep it in place.
So at this point, we're just having a discussion. I guess, what are the next steps?
I think we have to wait for what the mental health board wants to do.
Well, I would first do more data gathering. I would see what you can find and what you think is going to happen and what has been the case, and maybe a conversation with Kane County and what they're doing. Because I don't want the mental health board to start discussing it without any substantive information to allow them to make an informed decision. So that would be my ask, is that, you know, the board allocate or at least acknowledge that staff would provide time to put some of that data together.
And the State's Attorney's Office is working on this now. I've talked with Norm and Kyle. They're barreling ahead. They know the time frame.
But I mean also some numbers, so that they have an idea of what's happened in other areas, whether it's for mental health or not. Maybe some information about Winnebago. I mean, I keep hearing about this dip, what precipitated that. You know, some things like that. So we have answers to the questions that I'm certain that they will have. Yay? I mean, yay.
Yes.
And I'll just say, I don't think, I would personally prefer to see the referendum be on the March ballot. I do think it would pass. I think it's popular. I think it's a popular proposal. And I personally would want the mental health board discussing it at the November meeting, even absent numbers, just to get the conversation started. And as far as dips, I mean, even a 25% dip would put them at the same funding level that they're currently at.
Don't disagree, Eric.
Yeah.
Just know that they're gonna ask the question. Maybe there's a reason that happened. I think McHenry is different substantially than Winnebago, even with our base.
Yeah.
So,
Right.
but I know the question will be asked. It would be nice to be able to have the information and not say, I'll get that to you.
And it's probably something that the mental, just my 2 cents, it's probably something, that the mental health board would have to plan for, knowing it's not going to be just, a near constant revenue source. It might be something where, even if you do bring in, 14.3 million, not all 14.3 million spent that year, maybe put a couple million in reserves, anticipating that there's gonna be more volatility.
I think it's helpful to know that Winnebago went to the sales tax because they could not pass a 708 property tax levy. They tried 3 times. And then after that horrible period where Governor Rauner held everybody at Medicaid, Janet Waddles went bankrupt. They went out of business.
Yes.
And so they literally had very thin services, mental health services for people in Winnebago County. And they so in the 90s, there was a referendum on our ballot to increase the levy from I can't remember the details. It was sponsored through the mental health board, or I know that we worked on it diligently, and that levy increase passed here. And so our history, as Pam says, is very different from Winnebago. And I think that, and I'm hoping that the mental health board will find a way to research some of that historical data to see in what way will this benefit the growth of mental health services, or inhibit it. And my last question, is there a possibility of doing a levy and a sales tax? I mean, I don't know, I'm just putting that out there. Like a lesser sales tax and lowering the levy. I don't know.
Well, Pete, you mentioned having
Yeah.
that.
I don't know that you can do a smaller increment than a quarter cent, and we're gonna.
Yeah, I don't either, Pete. I don't know.
I'm saying no.
Do I think you can have both revenue sources in place? Yes.
Oh, okay. Okay, well, thank you.
Does anybody have anything else to add?
We started the discussion.
Yeah, okay. Well, I look forward to attending the mental health board meeting
And I'm gonna attempt to as well.
yeah, it's an important thing and I think it's a good thing that we're looking at other scenarios. And
Thanks for coming.
Yeah,
Thank you for coming.
Okay, reports. Workforce housing. Pam, Ms. Metz?
Yeah, so we had a great meeting last month with two mayors, the mayor of Geneva and the mayor of Cary presented, and it was great. I think everybody really got a good look at what the number one barrier to workforce housing is. And both of the mayors talked about they're not sure that they would ever do another affordable housing project in their city again because the pushback from the public was significant. Cary has a wonderful project called The Gardens, and Geneva has a project called Emma's Landing. I think they're going to be a great resource to us. So we're also putting together the outline we're starting to work on the white paper that we're going to generate to Public Health first, right, Pam?
Yep.
And then to the COW, right? So you won't get that for a couple of months. Next month, Ida is coming in to talk about financing. And I think people think that the reason we don't have affordable housing is because our property taxes are too high. And that is really not the number one reason. I would say community pushback and the complexity of financing these projects. So that I think is becoming more clear to us as the group is dynamic. They're really they're developing a muscle for this issue. And so we'll continue to put together the information and the data and have something I think you'll find really interesting by the time we're done. Pam, do you want to add?
Nope, I think you did good.
And could we get the white paper when you send it to the
You're
Department of Public Health?
gonna get it before anybody else gets it.
Okay,
Yeah.
thank you.
This committee will get it before it goes even to the board,
Okay,
right? We report directly to this committee, so
Along
we'll give
with-
it to you guys first and then,
cool.
yeah,
Thank
and
you.
get your input, et cetera. And
Just for clarification, IDA is the Illinois Housing Development Authority. It's a state agency that administers all of the grants to the affordable housing developers.
Lou is usually the one that asks what the acronym is, but she knew this time, so she knew.
The other thing I want to say is there will be, we are adhering to our year. We were created to the end of May. We will be having recommendations, next steps that we think the group will generate and recommend to this body inside of that paper.
We've been, the only thing I'll add, Eric, to your question is we've been really careful. A lot of people know that this is going on and they've asked for access to the group and, you know, direction and going in different. We've been very clear that this is contained to this, and before we do anything, this body, this committee, and the county board need to know what we've discovered and recommendations, et cetera. So we're pretty contained and committed to the fact that we have to report to you guys first.
Thank you.
Yeah, no, yeah, I'm anal about stuff.
Yeah, and I, thank you, Pam, because we have had, you know,
And
people
pushback.
who, yeah, well, people who want to recommend that we do certain things or we look, and we're very focused. And so while it can be, you know, attractive to think about some of these things, we've really said, no, you know, we're staying, this is where we're supposed to be right now.
Okay, great. Thank you, Lou.
Mm-hmm.
Can I just real quickly, I apologize, it's not really on the agenda. I just wanted to give you guys an update. If you'll remember, we had the contingency fund with regard to the Senior Services Grant Commission for transportation. We did finally hear from PACE, and they are unable at this particular time because their budget's already in place and public comment has already been closed to address our request for funds from their side of our transportation program for senior transportation. So it looks like we will have another Senior Services Commission meeting and we will allocate that contingency fund to the townships to continue providing transportation to that senior population. I did attend yesterday's Transportation Committee meeting. We did have a very extensive conversation, both Michael and Tracy, or Michael was there, Tracy is on that committee. We had a very extensive conversation about what that need is and that it is somewhat unique for seniors and that not all seniors should be dumped into one definition. The needs for seniors, depending upon their physical health and intellectual capacity, is different. But there is some major discussion about what McHenry County needs to do, and so those conversations will continue over the months collaboratively together with transportation in this committee, and we'll keep you apprised as to where we're going. But one of the things I do want to stress again at this committee level is the real need and desire of many county board members to push both Metra and PACE about the level of services that McHenry County is getting in comparison to the level of financial support we are providing. So you may hear that they are coming before the Committee of the Whole this month. And so just to let you know that that conversation will occur. So
PACE and Metra?
yes,
All right,
yes, yes. So just letting you know that, you know, we are asking them to give us some consideration as providing that kind of, you know, higher level amenity senior transportation where it's needed. So, thank you.
It's maybe a question for Scott and Pete. One of the points that came up in that discussion yesterday was that we're a net funder of, I believe, of PACE. Do we know what the delta is relative to Cook County or the other collar counties?
I do not know that. We can ask DOT, they may have that.
Yeah, I would imagine Scott Henning has that information readily available.
Okay.
But obviously, all of our money typically ends up going to Cook,
Yes.
you know, and supporting the city of Chicago as opposed to really the suburban area. I mean, we've been working the example of Hunt Lake 20 years to finally get the extension by Metro.
I'm really surprised.
Yeah, 20 years.
Pam, I want to thank you for having the foresight in creating that contingency fund and seeing, you know, the need for the seniors that do use those services. It's a pretty specialized service that those townships and the village of Hebron do provide, and I think that's really important to look at. I know there's been pushback the last couple of years with the talk of, you know, duplicative services, and my personal feeling, it's not a duplicative service. We don't have anything right now that does fill those needs for those seniors. And it's, you know, the seniors in those regions, you know, in the rural areas is the highest rate of growth in that population. And to service that area is incredibly difficult. And, you know, I appreciate you, you know, keeping that on the table. And
Well, the good news is that we are, from an efficiency perspective, we are addressing how we can provide those services more efficiently. McHenry Township has stepped up. They're a little bit more sophisticated in how they organize their services. They're working very collaboratively now with Riley and Hebron. I mean, I think that there's a long way to go yet, but we are addressing it in the best possible fashion. And there's substantially more conversation with our senior organizations and providing those services and how we can do it more efficiently so that we're utilizing money more appropriately. So that too is the good part of all of this.
okay, do we have anything else for future topics?
I think we decided last month we had enough.
I kind of agree, between the workforce housing and now the, you know, extra with transportation. I do agree, and there's no need for executive session. So I'm looking for a motion to adjourn. Mr. Shorten, Ms. Van Hoff, all those in favor? Aye.
Aye.
Thank you.
Aye.
Thank you.